Marketing healthcare in the digital space can be challenging. To be truly effective, there really has to be a seamless connection from the call to action in a digital ad to what is desired on the website when someone goes there. For instance, if your digital ad says, "Now accepting new patients," you need to be able to accept new patients in the digital space. If you don't, your prospective patients can end up going somewhere else where it is easy to do that. For many smaller hospitals and medical practices, that can be a hurdle that is hard to overcome. One potential solution is to develop a landing page or a microsite that's totally dedicated to receiving those who respond to your call to action. Consider the following suggestions to help you get started. One of our client hospitals wanted to increase primary care patients. To do so, we first reviewed the existing website with an eye toward the user experience. We found that there were too many potential actions on the page. There were multiple phone numbers for different practices, multiple links to different locations, multiple connections to other websites. It was just very confusing. To simplify matters and focus a potential patient, we revamped the page by adding a very large box with very clear language about request an appointment today. Made it very, very clear that that's what we wanted someone to do. Clicking on this button led to completing a form email that was sent to the hospital with instructions that someone would get back to them within 48 hours. We made it very easy to connect with us. We made it easy for a prospective patient to know just what to do. Quick note on this, however, you can set it up like that on the landing page, but if the back end isn't working, that's not good either. You need to make sure that someone is going to get those emails, that they are going to respond within 48 hours, and that there will be the seamless connection to a provider looking for patients. A second example involved the development of a microsite to serve as a virtual center for a collection of services. In this case, it was for a virtual women's center. And to go into a little more depth, what happened is that there were a lot of different services that were being offered to the women of this community. And the hospital wanted to put them all together. Now, we couldn't put them together in a physical building because that just didn't make sense. If you're going to receive cardiac care as a woman, your cardiologist is probably seeing other people as well, not just females. So that office couldn't be located in a physical women's center. But what we were able to do was to create a virtual center so that all of these services for women were together in one landing page, one simple place to access whatever services a woman might need for herself or her family. We also further segmented the content to make it age or stage of life specific. What do you need to know at age 20? What do you need to know at age 40? What are the tests and concerns you have at age 60? One constant throughout the site, however, was again, as I said earlier, that request an appointment, making it very easy for people to find exactly what they needed to find. It came about as a one-stop shop for information and resources for women. We didn't try to replicate pages that were already on the site, but really kind of captured them all in one easy to find, easy to access resource. The bottom line is that it's important to follow through on your digital advertising by making sure that prospective patients know just what to do when they get to the website.